Kelsey's just messaged me saying who's talking. So that you know. Just sit at the tail end early just so I don't have to go up and board for later. So.
Well, kia ora koutou katoa. Nau mai haere mai ki te Manatū Hauora. Thank you very much for coming out on a Sunday for this update today. There is a new community case of COVID-19 to report in New Zealand today. I will run you through the details of what we know about this case, but I will say from the outset that this is a case that shows our systems to identify cases early are working, and we have a clear line of investigation into the source of this person's infection. This case has also been caught early, and the risk of onward transmission has been quickly contained. The case is a man whose employment involves him working on ships at ports in New Zealand, including in the past 2 weeks at the ports of Auckland and ports of Taranaki. We know the border is an area of risk for more cases of this virus to emerge, and that is why we have regularised routine testing for many people working at our borders and other stringent measures in place. This man has been concerned about getting his regular COVID-19 workplace tests and has been tested fortnightly over the last month or two as part of routine border testing. Most recently, he returned a negative test result from routine testing at the ports of Auckland on the 2nd of October. On Friday, the 16th of October, after developing respiratory symptoms, he did the right thing. He rang Healthline, was given advice to be tested and then go home and self-isolate because he is in that category where there is a high index of suspicion given his work. The test returned a positive result yesterday afternoon. We immediately, of course, put our contact tracing systems and testing into place to ensure there are not more cases associated with this man and to prevent any further onward transmission. His close contacts are either self-isolating or have gone into a quarantine facility. Because the man was tested so quickly after developing symptoms within the space of a few hours, we were able to identify and isolate his own close contacts within a space of a few hours after receiving the test result yesterday afternoon. This, of course, is an important lesson for all of us. Because he was tested on the day he developed symptoms, we've been able to move to quickly contain and prevent any onward spread of the virus. So all New Zealanders do need to remain vigilant for any symptoms of COVID-19, and once again repeating that request, if you have any symptoms, get a test, don't wait, get it done promptly. Testing quickly means we reduce the risk of the virus spreading, and that puts us in a very good position to put a circle around any infections and prevent any onward community transmission. I'll now run through what we know about this man's movements and potential contacts while he was potentially infectious, which is Wednesday the 14th of October and Thursday the 15th of October, being the 2 days before he developed symptoms. I do want to say that the person, because of the nature of his work, had taken a number of precautions to limit his contacts with others, and his actions have been very helpful in terms of limiting the risk of further spread. So during the period of particularly on the Wednesday, I was in New Plymouth working on a ship at the port there, doing his work. And he checked into a local hotel and motel on 2 different evenings. Our public health advice to those establishments has been for the rooms that the man used to be deep cleaned. We do not believe there are any close contacts at these 2 establishments. However, we are using CCTV footage where it's available to confirm that, and staff at the establishments can be tested. Any that the man had interaction with are being offered testing. His close contacts from his work in New Plymouth are being scoped, and those are largely the people on the vessel that he worked on there. In the course of his work, as a requirement, the man uses a mask and gloves, and of course any crew on the vessels he is working on are also using PPE, namely masks and gloves. The people from that vessel he worked on in New Plymouth are being treated as close contacts. That ship is en route to Napier and arrives there this afternoon. We have the public health unit in Napier and other port authorities there work carefully and closely to get in place plans to isolate and test the crew there once they arrive. But what I can say is that the contact has been made with the vessel and no one on board is symptomatic at this point in time. The man travelled back from New Plymouth to Auckland on Wednesday evening and was not at work on Thursday. He was at home and he was not symptomatic then, and he only made trip out some food. We are preparing push notifications to said COVID Tracer app for any particular exposure events, and again reiterates and underscores the importance of people using the NZ COVID Tracer app to of movements. The man went to his workplace on Friday. As soon as he became unwell, as I said earlier on, he contacted Healthline, went home and was tested on the way. And the testing, the place where he was tested, followed all the proper protocols. So there's no hint of any close contacts there. 4 household contacts are in isolation, 2 of them in the quarantine at the house where they live, and they have been tested. The man was not at the ports of Auckland during his infectious period. So in response to this case, we are scaling up to Auckland and ports of Taranaki. All workers there actually tested, and is in addition to the regular testing that is happening at those sites. As always, we encourage anybody who has any symptoms to ring Healthline for advice on getting a test. So just in summary on this case, we have a very good example here of our system, our border measures, our testing, our contact tracing working well to help us ring fence any possibility of further spread. And it's another salutary reminder that this virus, whilst we have prevented and eliminated community transmission here in New Zealand, we're all well aware that is not the case in many countries overseas, that in many European countries, the UK and the USA, the virus is spreading and increasing through those communities, and they are, particularly in the UK and many European countries, having to institute quite significant restrictions on movement to get ahead of and on top of the virus. Turning then to our regular numbers, there are also 2 imported cases of COVID-19 to report today. They're in managed isolation facilities. And there is also 1 new historical case of COVID-19 to report. This is the case that we first identified as under investigation on Friday, and we're now officially including in our reporting statistics. That person is considered to have recovered from their infection. In fact, that is an historical case. The infection happened and with acute infection happened prior to that person coming to New Zealand. And as we often see, when people get respiratory symptoms for another reason, it can result in particles, fragments of this virus being detected, and we've seen this a number of times. One of the cases from managed isolation that we reported yesterday has now been recategorised as under investigation, also to see if this is an historic case. And that's been removed from our tally until that has been resolved. So our total number of confirmed cases is now 1,530, and our total number of active cases is 42. A little more on the 2 new cases in managed isolation from today. The first is someone who arrived on the 5th of October from England via Dubai and tested positive at routine testing around day 12 of their stay. The second case is someone who arrived on the 13th of October from Dubai and who tested positive at the testing around day 3 of their stay. Both of those cases, as we always do, have been transferred to the Auckland quarantine facility. And on the subject of laboratory testing, yesterday there were 3,390 tests for COVID-19. So, just some concluding remarks. I know that the re-emergence of a case that is outside of our managed isolation facilities may be unsettling for people. And the very best thing, of course, is to remind ourselves that we need to remain vigilant. Do monitor your health for any symptoms of COVID-19 and seek advice about getting a test if you develop any symptoms such as a new or worsening cough, a sore throat, a runny nose, a loss of sense of smell or fever. The case is another reminder that COVID-19 is not going away anytime soon, and that is why we have a significant ongoing active response. However effective our response might have been to date, the only thing that matters is how effective it is now and into the future. We all need to keep playing our part to ensure that we eliminate community transmission of the virus each time we find it. That means staying home if you are unwell and promptly seeking a test, continuing to use the NZ COVID Tracer app as part of your daily routine, excellent hand hygiene and cough and sneeze etiquette. And the Ministry of Health also continues to recommend using masks on public transport and flights. Remember, alert level.
The election, lots of people gathering, close proximity. Was there any thought behind perhaps alerting the public earlier, especially in these areas where this person's been?
Well, as you'll see from the description of this case, there's a very clear explanation because of the nature of his work as to where he might have been infected. And he, once he was infectious, once he had symptoms, on Friday morning, he got tested and self-isolated. And the 2 days prior to when he might have been infectious, he was not actually out and about. So a very limited number of close contacts. So he drove to New Plymouth by himself, and all the people he might have interacted with were identified last evening. When as soon as the test result came back positive yesterday in the afternoon, we took the appropriate actions were undertaken.
So you're saying you didn't need to tell us yesterday?
We always tell give updates on cases at 1 o'clock the following day. All the people who needed to know, and that included the Minister of Health, who I contacted last evening at 11 minutes past 6, straight after a phone call we had with Auckland Regional Public Health, actually a Zoom call. I let the Minister know as a heads up, but all the people who needed to know were being told, identified, put in self-isolation and tested.
We still don't know where he got it from, though.
Well, one can see from the nature of his work that he is in a higher risk category because he actually not only is working at the ports but going on board ships. And for example, he would be often on board a ship for several hours working in his work, which is an electronics maintenance job. So we're not ruling out any possibility, and we've identified the other ship that he has worked on in the last 14 days. It's very unlikely the ship he worked on Wednesday in New Plymouth is the source of the infection because that would be a very, very short incubation period. So we've identified other vessels he might have worked on in the previous 14 days. One has been identified and that is now being actively followed up.
So he goes on the ships.
Have you done any genomic testing to establish whether there's any link to the Auckland cluster, or have you is this completely random at this point?
Genomic testing will be done. That usually takes a few days after we get the initial test result back. But the point you've made is a good one. Of course, one of the first things look to see if he might have had a link to the previous Auckland August outbreak. We're not taking for granted that just because he works on board ships that could have been the source of his infection. But certainly the genomic test, the whole genome sequencing will be helpful in terms of identifying where the type of virus that he has might have come from, appears in the world, and that will help us with identifying where the source of infection might have been.
And given that he works at a port, is it possible that he's contracted it from someone else who's come into the country recently? Is that something that you're looking at as well?
Yes, in fact, the nature of his work means he has the only people he interacts with at the port are the security people when he goes, accesses the port and then accesses the vessel. So his interaction is really directly on board the vessel with people on the ship. And so he's not actually, in a sense, a port worker per se. But obviously we want to make sure that, for example, if we go back and look at the two ships he has been on, that whether there were others at the ports who might have gone on board those ships. The nature of his work is he tends to spend longer on board than others would be, for example, the pilots or those unloading cargo or having interaction with crew around unloading of cargo.
Historically, there has been concerns raised about how stringent the border controls are at ports across the country. I guess you're kind of framing it that this has been picked up quickly, but what can you do to allay concerns amongst the public that the checks and balances aren't there?
Look, I think the key thing here is the public should be reassured that actually the measures around our ports now are very strict, including things like the use of PPE on board ships, the regular testing regimes, and just again to point out that this person had actually had 4 negative tests, the last on the 2nd of October as part of that regular testing, assiduous in getting those fortnightly tests. He was due for his next one actually on the Friday when he developed symptoms, and his close work contact had their regular testing on that day, and so that result's been followed up rapidly as well. So what I can assure the public is that we're constantly looking at and learning and strengthening our border measures, both at ports and at airports. So there's a follow-up question.
Just to clarify with the ships, these are international ships that he's going in and working on and then coming on with international employees on that ship?
They have international crews, and the crews are not allowed to routinely, they don't get shore leave. But that's why there are precautions in place, including minimising interaction with crew members. Both the crew and the people boarding the ships have to use masks and gloves.
And so for you, how's your kind of concern radar looking right now? Are you edging into the orange or still more of the green?
Look, it's a good question. And what I would say is that we've always maintained that if there are cases of COVID-19, we want to find them. And in this case, we've found a case very early on, very quickly. The person did all the right things, got tested on developing symptoms. We were able to identify and isolate all the close contacts within a matter of hours. Our metric for that is 80% within 48 hours. So this is exactly what we want to be able to do, to early testing, early isolation, early identification of close contacts, isolation and testing is how we will just stay ahead of this virus. So at this point in time, we feel it's lowish risk of any further community transmission, but of course we're wanting to do everything we can precautionary to try and rule out any community transmission.
Are you expecting a couple more cases to come in around this person?
We'll just have to wait and see.
Is there regular testing at the ports in Taranaki? We were under the impression
Yes.
that there isn't regular testing.
There's now regular there's regular testing at all ports around the country. The two that, whereas there is the most intensive regular testing are Auckland and Tauranga, because that's where most of the ships that come from internationally, it's their first port of call. But then a number of them then do go around ports. So the ship that he worked on, for example, in Taranaki, had previously been to Littleton, I think also Auckland, Taranaki, and now it's on its way to Ahuriri Napier.
So how regular this testing is, what's involved, how often is it?
Yes, I don't have the details of that, but we can provide that exactly, because there are the higher risk groups, the people who, like pilots or those who go on board the ships, and they're on a more regular testing than those who might be just on the wharfs, but who have potential interaction with crew because they're unloading, and then less regular testing for those who don't have direct interaction with crew.
So you're not actually sure how often Taranaki port would be tested?
I don't know off the top of my head. Remember, we've got, I think, 15 ports around the country, so but we'll get that information.
Dr. Bloomfield, has there been any consideration to regional lockdown potentially around New Plymouth, or has the ministry given any recommendations around any change in alert levels?
No, we haven't, and we're not considering that at the moment. Again, I think if you look at the description of this case, remembering that he didn't develop symptoms till Friday, which was over 24 hours after he left Taranaki, and I guess I can reassure people in New Plymouth that the risk to people in New Plymouth is very low. He had minimal interaction with staff at the motel and hotel that he checked into. His work was on board a vessel at the ports, and also saying there is testing available in New Plymouth, and the CBAC there, the Community-Based Assessment Centre, has extended its hours today. So anyone who does want to test, and particularly, of course, anyone who's symptomatic should seek a test, and it will be open for longer hours today.
What's going to happen in Napier when this vessel arrives? Can you talk us through what the process will be, and also whether or not this case has now been shifted to Jet Park?
So on the latter, yes, the person and the case, as well as the work contact and 2 of his flatmates, are actually in Jet Park now, being tested. In terms of the ship when it comes into Napier, the Public Health Unit and the port and our border officials are working on a plan there. I don't have the details yet, but obviously there's an opportunity to keep the vessel either at anchor until the plan's all ready, but contact has already been made with the vessel, and as I said earlier, no one on board has any symptoms at this point in time.
So you could potentially see them just maybe self-isolating on the vessel? Signing off.
I'll leave that to my colleagues at Napier, but as soon as we've got an update on that, we'll let you know there.
Sorry, just to clarify the time frames, he was in New Plymouth, did you say, at two different accommodation sites?
Yes. So he drove to New Plymouth himself on Tuesday, checked in, and then worked on the vessel Wednesday. He checked into a different accommodation establishment on the Wednesday evening, I think for a short period, and then decided instead of staying the night and driving back to Auckland Thursday, he would drive back on the Wednesday evening. So he drove back the Wednesday evening and spent Thursday pretty much at home the whole day, not because he was unwell or symptomatic, but just that would have been his travel
Did
day.
you make any stops?
That is, of course, all been looked into.
Dr.
Yeah.
Winfield, it does still seem concerning though, given the amount of PPE that port workers are wearing and the protocols in place and stopping people coming into contact with one another, that a port worker has then got COVID somehow. You say you're not overly concerned, but there is that chance that he may have picked it up in the community, right?
There's a chance he may have picked it up in the community, and we're keeping an open mind about this. But on the face of it, there's a very good explanation for where the likely source of infection is. But what it is a reminder is that, I've said this before, it's a tricky virus. And yes, the reason why we don't just rely on one thing, we don't just rely on PPE, we don't just rely on the regular testing. The important thing here is that even that as soon as he developed symptoms, he sought advice and was tested. And that, I think, is a really, really good example for all of us. And that, of course, is why we also have our contact tracing ready to go and all our other measures. There's been a good description of this given. It's like the slices of Swiss cheese. And what you want is a whole lot of slices so that if something gets through one hole, it doesn't get through the hole in the next slice. And that's why we have all the measures in place that we do have.
Two of his close
Places that he stayed in New Plymouth, the people self-isolating from there.
The people with whom he had interaction, the check-in staff and so on, they are isolating and are being tested, yes.
Two of his close contacts, are they symptomatic or is anything?
No, none of them are symptomatic at this point. And the timing of testing for them, we're doing immediate testing. First of all, to rule out that one of them wasn't the source of the infection, of course, and that we're picking up someone that he's caught it from a flatmate or his work contact. None of them are symptomatic. Then the further testing is 5 days after after he first developed symptoms, and then 12 days. So we do 2 or 3 tests during that period. And during that time, close contacts remain in isolation throughout that period, even if they return a negative test.
And what was the symptoms?
Look, I think he fairly typical symptoms. I think he felt quite unwell, so I think a cough and sore throat and so on. But I don't have the detail
Are
on
these
that.
ports going to be operating from tomorrow, or at the moment are they still operational?
Yes, they're still operational, and obviously the regular routine testing will continue. And there's some extra testing stations going into them today just to
And
talk to
cleaning
the port.
also?
Well, there's no particular need for the ports to do cleaning because, again, the nature of his work was that he accessed the port to get to the vessel and he'd be on board the vessel doing his work and then leaving the port. So there's no particular need for any additional cleaning at the ports.
You said there are 2 ships that he could possibly have been working on.
There are 2 ships that he has worked on in the last 14 days. One was the one in New Plymouth on Wednesday, and there's one other prior to that is being followed up as the most likely place that he may have become infected. So obviously it's really important for us to get to the bottom of what might have been or see if that was the source of his infection.
What will you tell us about that ship? Is it a New Zealand ship?
I don't have that detail, but obviously, including since last night, we've been working with our border colleagues, Customs and Maritime New Zealand to follow that up, as well as our border team. So we'll give you as much information as we can about that as it comes to hand.
Do we test on those vessels?
We don't routinely test on the vessels because the people are not coming off.
And then putting Kiwis on board with them?
Yes, where they need to, of course, and with appropriate precautions. And then we're doing the regular testing of people who have been on board any of the vessels. So again, all of these situations when they come up are an opportunity of us to do a careful review of what procedures and expectations are in place, and then is there anything we need to change.
Yeah,
So
that was my next question. Is how has this case changed the complexion of how you might work with deports or any of those types of things moving forward?
Well, what it doesn't change is that we'll continue to work really closely with them, which is what we have been doing. But we will again take the opportunity, especially as we gather more information and investigate this case, to look at are there any additional things we could do particularly for people going on board the ships, around the nature of how they work on board those ships, and also the nature of the testing. For example, if they go on board ships, do we, especially if it's intermittently like this, rather than being regular testing, one option could be that we automatically test them within, or at 48 or 72 hours after they've come off the ship, which may be an option. But we'll look at all these opportunities to see how we might continue to strengthen the system.
Sorry, when exactly did you first have suspicion that this was community transmission?
Well, it's not community transmission. I might just point this out. This is most likely a border-related case. That's what we're saying. And so far, there is no evidence of any onward community transmission. We received the test result, and I got the phone call yesterday afternoon at 4:38. We had a teleconference at 5:30 with the public health unit.
Just are you able to tell us the names of these places that you stayed at? People
Yeah.
who stayed there or visited the concern?
Look, I don't have the names of those places here with me, but we will be making that available, and also using the NZ COVID Tracer app to push out notifications to anyone who might have been there during that period. The key thing for those, for people, of course, including those who might have stayed at those establishments, is if you become symptomatic, seek advice quickly and get a test. Any other questions?
I kind of have one that you might have already covered off.
Sure.
Apologize if that's the case. You're only looking in the previous 2 weeks on those ships because of the span of the illness. Like, is it possible
Yep.
that you got it before those 2? You know what I mean?
It's possible, but one of the things we also have is the fact he was tested on the 2nd of October as part of the routine testing and returned a negative test. So we're going back the 14-day period, because we know that's sort of about the outer limit of incubation of this virus. And aside from the vessel he worked on in New Plymouth on Wednesday, there's just one other vessel in that previous 14-day period. Good, thank you very much. Appreciate your participation today.